Thank you. I appreciate all of you for joining us today. My name is Joy Stiles. I am the councilwoman for District 32. I promise you that your trip and your time will be well worth it today. Before I begin, I would like to acknowledge our elected officials that are in attendance today. We have Councilmember Bob Nash, Councilmember John Rutherford, Councilmember Robert Swope, Councilmember at Large Sharon Hurt, Councilmember Taneka Vercher, Councilmember Tom Dreffel, Councilmember Delicia Porterfield, Councilmember Russ Pulley, and we have our property assessor Vivian Wilhoit and our Register of Deeds Karen Johnson. Thank you again for coming. Several of you are former Southeast Council members, so I know that this site is near and dear to all of your hearts. While I know that I can be long-winded, I'm going to keep my remarks brief and tell you why we are all here today. After many years of speculation and envisioning by myself and my Southeast predecessors, the mall has a new owner, a new future, and a letter of intent with a phenomenal tenant. The interior of the mall, as you can see behind me, which is 650,000 square feet, and the Bridgestone building, which is to, I guess, your right, is purchased by Metro, and their future will address community needs previously established in the last 2 years through community meetings and an electronic survey. In that survey, we said that we wanted to see more green space here on site, a place for our kids to positively engage and continue learning after school, a community kitchen that could be used for catering or private parties, and a co-working space so that our entrepreneurs have a place to build the future and get their ideas off the ground. We will also have additional Metro offices on site. As we move forward in this process, we will resume community meetings regarding the space and work in conjunction with the planning department to bring this vision to fruition. And finally, we asked about building a space for the arts, which have been missing for our area for far too long and have been greatly missed. I am delighted to share with you today that the existing event center that is connected to the mall will soon become the Antioch Performing Arts Center. I am as excited as you are. Once again, we'll be able to host the Antioch Art Crawl. We're going to be able to host dance performances, plays, and musicals. We're going to be able to introduce the arts to our youth out here in the Southeast, many of which that do not have the opportunity to go downtown and go to a TPAC or go to Nashville Ballet. We now will have the arts in our own backyard. I cannot move forward without thanking Dr. Raj Agarwal, the now former mall owner. Where are you, Raj? Raj. For allowing this mall to move forward and engaging Clay Haynes. And I thank you, Clay, for your investment. Where are you, Clay? I saw you. There you are in the back. Thank you, sir. Thank you for your investment and your belief that this site was a perfect spot for a new vision. All of this work led to Mayor Cooper and Metro being able to carry all of this hard work forward and bring us here today. Thank you, thank you, thank you. We are all so grateful. Now that we have discussed our community needs, let us speak about this new opportunity on site. This organization is phenomenal, not only because they will bring new jobs and new opportunities, but also they will be providing a much needed industry in our area, and that is healthcare. The Southeast has not had a major healthcare presence such as this one. Today, we are excited to share, should all the stars align, Vanderbilt University Medical Center may be our anchor tenant in the space behind me. In fact, the view that you see behind me would lead into that space. With a wealth of experience with their mall to medicine model at 100 Oaks, they would be a great addition to our community. Joining us today, we have Dr. Jeff Balzer, President and CEO of Vanderbilt University Medical Center. Where is Jeff? Ah! There you are. So you can't come up yet because I have to give a little bit more of an intro for you. Since becoming CEO in 2009, he has expanded patient care to over 2.5 million people and managed revenues of $5 billion. Yes, that's billion with a B. And I would be remiss if I did not say that in addition to being an expert physician and executive, he also has a fantastic sense of humor and is married to a wonderful Wellesley woman named Belinda. He is now going to share about Vanderbilt's why here and why now. Without further ado, please welcome Dr. Jeff Balzer.
Thank you, Councilwoman Stiles. We appreciate your leadership and greatly look forward to working with you and all the members of the Metro Council. I want to acknowledge and thank Mayor John Cooper and his terrific team for their leadership on this. I'm really delighted to join everyone for this announcement. What we're discussing today has the potential to be transformative for Antioch and Southeast Nashville. Through this partnership with Metro Nashville, our goal is simple yet ambitious: to greatly expand not only primary care, but the full range of specialty healthcare services for the people living in the southeast part of our city. People who already use Vanderbilt Health, and many more people who could use our services if they had easier access. You see, Antioch and Southeast Davidson County rank among the fastest growing areas of Tennessee. So the rationale to create a large footprint for healthcare here is clear. What's perhaps less visible is that this area is one of Davidson County's lowest rates for routine health checkups. It's also one of the highest rates for COVID infection. So a priority of our efforts will be to move the care of this community to not only be one of treating disease, but preventing disease. While there's much to do, and we are not starting from scratch, in 2021, Vanderbilt Medical Center cared for nearly 160,000 residents living with zip codes in this area, 37013 and 37211. So we're already providing services to many people living here, but we also know that by having a physical presence here, we can do a whole lot more. Being here helps us make the healthcare for this community both available and equitable. To do so, we will leverage a lot of distinctive resources that many healthcare systems don't have. For example, the number of limited English-speaking households are higher in Antioch and Nolensville than in many other areas of Nashville. At VUMC, we have large-scale interpreter services to facilitate care for these patients and families. We're well aware of the mall's history. You mentioned my wife, Melinda. Melinda and I used to shop here when I was a Vandy medical student 35 years ago. We're familiar with the earlier efforts to redevelop the property, but as also mentioned, we have prior experience that's giving us confidence that working together, we can be very successful. VUMC was one of the first health systems in the nation to utilize this mall-to-medicine concept. And in 2009, we converted over 400,000 square feet of Nashville's very first shopping mall, 100 Oaks, and that's really transformed its presence over the last 13 years, and really the community around 100 Oaks has become a destination location for both healthcare and retail services. So here we have approximately 600,000 square feet, and this project has the potential to then be even larger than 100 Oaks. You see, unlike any other healthcare system in the Mid-South, VUMC trains doctors and provides fully integrated care in over 200 adult and children's specialties. What does that mean? It means the possibilities for service offerings in a facility at this scale are endless. We're also envisioning using portions of the space for a host of complementary services, such as food services, bringing jobs to the area along with important amenities for both our employees and our patients. In this context, I want to express my great enthusiasm for our future neighbors right here in the mall, Nashville State Community College, the Ford Ice Center, and the Southeast Community Center. First of all, thank you to the Community Center staff for hosting us today. A round of applause for them. Many of you know the Ford Ice Center is sponsored by the Nashville Predators. The Preds are among our most steadfast and important community partners and supporters. They dedicate both time and resources to the Monroe Carroll Jr. Children's Hospital at Vanderbilt. And through a growing strategic relationship, VUMC already works with Nashville State's programs in allied health career development. We've been reminded throughout the pandemic of the critical role allied health professionals play on our care teams. The very people who are graduating from Nashville State are essential to many aspects of the care we deliver, and we really look forward to further strengthening these ties. It's now my honor to introduce Dr. Shauna Jackson, the president of Nashville State. Dr. Jackson's been serving as president of the 6-campus comprehensive community college since 2018. Dr. Jackson.
Thank you, Dr. Balzer. I am thankful for this opportunity to stand before you today and share in this exciting announcement. But for me, this isn't just about Nashville State. This is also a personal celebration. You see, when I first moved to Tennessee in 1994 to work for the Pillsbury Company, I was highly encouraged not to live in Murfreesboro, but right here in Antioch. Why? Because this was the vibrant and growing part of Nashville. I lived in chimney-top apartments just over a mile from where we are standing today, and I was a consistent shopper at the Dillard's that is now home to Nashville State Community College. Right here in Antioch is where I fell in love with Middle Tennessee, made lifelong friends, and started dating the guy I've been married to for 25 years. This community is deeply important to me, and I and the college want to do everything we can to build upon this new opportunity to help local residents prosper. As Nashville's community college, we provide the first 2 years of a 4-year degree, career entry programs, and technical certificates. Opening in the fall of 2012 with 800 students, we grew to over 1,800 students at our second largest location, which is the Southeast campus. And it is our most racially diverse campus. Unique to the campus at Southeast is our amazing culinary program and law enforcement academy. And we are so proud to serve a very growing ESOL population. At the campus, we actually expanded the second floor in 2016 and added classrooms and study spaces. However, we still have 40,000 square feet of unused space to add new or expand programs. So we stand committed to working with the city, Vanderbilt Medical Center, and other partners to meet the existing and emerging needs of this area, again, with local talent. I see our campus evolving into a center of higher education, as Nashville State will bring in area 4-year institutions and our TCAT in Nashville as partners when needed to support what I believe will be amazing opportunities for economic growth and development in this community. But what I know is that access to education is not enough. Many of our students work, they have families, and they face numerous barriers to completing college. Nashville State is laser focused on building holistic supports for our students. Our College Foundation provides assistance for needs beyond financial aid, like tuition and fees, including transportation and childcare vouchers. But what we know is that gaps still exist for students and more resources are needed. A program only for Davidson County residents who attend Nashville State full-time is Nashville Grad. Launched in 2019 with the support from the city and other partners, Grad provides textbook assistance, a laptop, a monthly support of $100, and a designated success advisor. Grad is making a difference for the students at all of our campuses, but also the Southeast campus. And now we have Nashville Flex, which is a grad-like program for part-time students. And this was accomplished through a partnership and a grant with the Tennessee College Access and Success Network. I encourage anyone listening, thinking about college, to contact us at the Southeast campus to learn more. I think you will find that you belong at Nashville State. This fall marks our 10th year at the Southeast campus. I am filled with hope about what the next decade will look like for our college and the Antioch community because of the investment being made today. I am excited about the opportunity and potential to partner with Vanderbilt University Medical Center. Healthcare leaders like Vanderbilt need skilled workers to grow and thrive. Together, we can create unique and innovative pathways to increase the talent pipeline, again, with local residents. I applaud the city, and especially Councilwoman Stiles, who I know has been instrumental in assuring that this property is developed for the betterment of the community. Next, I am pleased to invite someone who has been a strong supporter of Nashville State, who believes in the power of education, and shares with me a common mission to create a Nashville that works for everyone. Mayor John Cooper.
Thank you, Dr. Jackson. This is obviously a great day for Antioch, and it's a great day for Nashville. And I want to thank Councilwoman Stiles and then all these council people. Joey, we're going to have to get to work on them. All those council people in the back. We need your help, each one of you, to get this done. And also, I want to acknowledge the school board member Fran Bush is here. And to Dr. Balzer, our great partner in this project. But let me do some thanking. Not only the people in my office, Saul Solomon that worked on this, et cetera, but Dr. Argawal and Clay Haynes, you have helped facilitate this great day for Nashville and for the bright future for our city. And I also want to thank the Joe C. Davis Foundation, which assisted in securing the Bridgestone property and will help us ensure that this property is activated as a multi-use space for the community. They've had a great vision. They put the shoulder to the wheel for this community, and I want to express my gratitude to them. But this is a momentous day for our city and Southeast Nashville. This mall was once the largest and busiest in the state of Tennessee, but its future has been uncertain for a while, and today marks the beginning of the long-awaited revival as a community hub with these great partners. And here in Southeast, we've made investments in public safety and parkland, and now we hope to bring healthcare services and job opportunities and even more benefits for the community. That's alongside our wonderful library and community center and Nashville State and the Ford Ice Center. We're having the magic of a recipe for success coming together. Now, I'm thrilled that with our intention of Vanderbilt's world-class health care and serving the underinsured and uninsured in this community, there will be the opportunity to deliver other community benefits, like a facility for the arts, metro offices and services, child care, resources for entrepreneurs and small business. This purchase is the latest in a series of investments we have made in Southeast, including the new police precinct and the new city park off of Tusculum Road. But this investment it's going to have great dividends for the community, and through our partnership with VUMC, it is our hope that this project will end up, frankly, paying for itself. So today's announcement follows extensive community engagement, and that process will continue to guide and inform the best community uses for this space. And I want to thank everybody for coming here. I think we can all date this as a great event for the conclusion of the past and the first day of our future, and I'm grateful to Dr. Jackson and to Vanderbilt for being partners in that work and for creating just an awesome community here in Nashville, and we need your support for this. Thank you very much. Thank you. Thank you, Joy.
I am jumping back up here one last time, again, to thank all of you for coming out here, because today is an auspicious day, and we have so much to celebrate. This is the beginning of something great yet again. So many people have memories of the Hickory Hollow Mall when they were kids and when they first moved here and how they spent their time. We're going to give people new memories of the same space, envisioned in a different way, and it moves our whole community forward in a way that we've been asking for years. So again, I'm grateful for the partnership. Thank you, Dr. Balzer. Thank you, Dr. Jackson. You know we've been working on this for a minute. Thank you, Mayor Cooper, making the investment in the Southeast. And I look forward to all of our next steps. It's going to be some more heavy lifting, but I think the lift is going to be a little bit lighter because getting to today was really the first step. So thank you once again.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information on this and other programs, visit nashville.gov.